just two real thin lungs sit above the diaphragm, exchanging CO2 for oxygen. Just some diseases that chronically obstruct the poem. Let's learn about our BAM and SLAM farm drugs. Nursing students, where you at? We're here in the pulmonary unit. Asthma, COPD patients, where you at? Raise those inhalers. Let me see them.
To our Breathin Easy podcast. Today we have an excellent panel that will explore the topic of burnout amongst healthcare staff. In this episode, each speaker will focus on different aspects of burnout and some possible solutions. To start, we have Ken, who will kick it off with self-care. Take it away, Ken.
Hello, everyone. So thank you for having me today. So today we're going to talk about certain types of self-care that we can do. I know for me, when I started working, I was really burnt out with just all these projects and meetings I had to do. So eventually I had to slow it down a bit and tell myself, like, I need to start doing stuff for myself because work was starting to be too consuming. So one day after a very long shift, I was tired, I was getting burnt out. So I went home, and what I did was I called my friend Jack and then my other friend Daniels. And then I just hung out with them for like an hour or two. Well, I guess you didn't get that joke, but okay. But anyways, but realistically, like I just had to focus on just doing stuff for myself just to clear my mind. And one of the things that I actually worked on was making a priority to go to the gym and exercise regularly. According to the National Institute of Health, they said they recommend about 30 minutes of exercise a day just to have better health and mental health as well. Another thing that they also recommend is getting plenty of sleep. So anywhere from 7 to 9 hours a day will put you in a much better place for stress as well. But my advice is just kind of focus on things that make you happy outside of work, and not let work consume you, or else you're just gonna spiral down and not be as effective as work, or even wanting to even be at work at all. So self-care is probably the best thing that someone can do for themselves. That's pretty much what I have.
Okay. Thank you, Ken. You're starting us off with some strong, helpful solutions and not making our audience wait till the end for those pointers. Those were great suggestions. And I hope you, the viewers, took notes. And next we have Veronica, and she will be discussing stress management. Veronica, the mic is yours.
Thank you, Chandra. And great points, Ken. I'm just going to follow on stress management, because a lot of self-care goes along with stress management. It's important to set boundaries between your personal life and work. Like, leave work at work and leave your home problems at home. And like you mentioned, also it's important to exercise. For stress, it helps relieve stress to exercise regularly. It just helps improve your mood. So sometimes we forget just because time's not always on our side, but it's really important to do so. And also, don't like hesitate to seek support, whether from Jack, as you mentioned, or Daniel, but friends, family, anybody. It just helps. It just helps your day to day. While stress is like, there's no way to avoid it. Work, family, we just gotta remember to like put ourselves first. and kind of compartmental, what I mean. Um, Separate everything so that it doesn't like overwhelm you. All right, thank you, Chandra. Back to you.
Oh yeah, that was some great input for stress management. Um, Now we're going to have Elisa, and Elisa will talk about mental health awareness.
Hi, Chandra. Thank you for having me. Hi, everyone. Okay, so I'm going to talk about mental health awareness in the workplace. So, when we refer to that, we refer to somebody's psychological well being in their work environment. That includes like both your mental health status and work factors that can influence it, like, for example, workloads, work culture, interpersonal relationships, work balance, like these guys said, and it could have a positive or a negative effect on us. And the big issue here with mental health is that it has a big stigma. The biggest misconception is that mental health people who suffer from this have are either seen as broken or weak, but that's far from the truth because this can actually happen to anybody, especially caregivers, because you're so used to helping others and you forget about yourself. So it can have a profound effect on us. Like it can cause burnout, stress, anxiety, and even physical health problems. So again, like Ken and Veronica said, you need to really work on strategies to help you. For example, like foster good work life balance, cultivate a support system, surround yourself by friends, family that can hear you out and are supportive when you're going through this. Physical health, that's a big one. Exercising is known to help reduce stress and also access mental health services. Reach out to counselors or an EAP program. Another one is reduce the stigma behind this. Managers can help with this, creating like a encouraging, an open, supportive environment, and helping people to feel comfortable coming up to them and speaking about this. So I think we definitely have to look at that and remember that our mental health matters just as our much as our physical health, and try to really look into that and be aware of what's going on and how you feel. So thank you.
Wow, thank you, Elisa. That was amazing insight and information into mental health awareness. Thank you for that.
Thank
Next up, we have Olga, and Olga will give us some information on social support networks. Olga?
Hi, everyone. It's a pleasure to be here at Breathing Easy podcast. As we all know, healthcare workers are the backbone of our healthcare system. We dedicate ourselves to caring for others day in and day out. However, the demanding nature of our work, combined with high levels of our stress and emotional strain, can take a toll of our mental health and well-being. As healthcare workers, we play a crucial role in recognizing and managing our own burnout and mental health. This is where social support networks come in. So these social support networks consist of your family members, your friends, individuals who you work with. You want to seek professional support during challenging times. So sometimes just talking to your friends or a family member that you're very close to, you makes you feel a little bit better and makes your self-care journey a lot better. One key role of social support networks is recognizing that the signs of burnout and mental health among healthcare workers. Um, especially now when all this with COVID and the pandemic happened, people started going through PTSD and having a lot of stress and anxiety. So it's important to seek social support. And so just talking to friends, even your coworkers, and just letting them know that you weren't that you need help, they can help you, right? So one example of myself is I was becoming my coworkers noticed that I was becoming a little different at work. And so they started, talking to my managers, and they seeked out help. And so not a lot of people know, but every at every work, you have a homepage where there's so many resources out there for you. So I know at my work, we have EAP, Employee Assistance Program, and there's counselors there that help out, and they listen to you, and everything is confidential and it's free. So it's people who are professionals, and so they guide you and they make you feel better. So always remember to seek out help if you need it. Social support networks are the best thing. You're never alone. Just know that you're not alone, and if you need help, talk to a friend, talk to a family member, and seek these resources that we have at work, because they're very helpful.
Thank you, Olga. That was very helpful for teaching us to recognize behavioral changes. Um, Next, we're going to have Cynthia, and Cynthia will be talking to us about work-life balance. Take it away, Cynthia.
Yes. Hi, guys. Hi, everybody. Thank you so much for having me on your podcast today. I would like to dive deeper into the work-life balance and how to create strategies to prevent burnout in our profession. Let me start off by stating that work-life balance may look different to each practitioner, but one thing that I do believe is universal is that we need to maintain a work-life balance to function effectively in both roles. So, what exactly is work-life balance? It's the amount of time you spend doing your profession versus the amount of time you spend doing what's important to you outside of your work. Some common things or signs, rather, of an unbalanced work-life dynamic may be that you can't stop thinking about work when you're not at work. Your relationships, both at work and outside of work, are beginning to suffer. Excuse me. When you're not at work, everything seems uninteresting or unimportant, or you struggle to take time off when you're sick, when you're mentally strained, or simply when you need a well-deserved vacation. You feel guilty. So also keep in mind there's no perfect work-life balance. What I like to think of is that it can be a realistic one. But I do have some tips for the work setting. One would be to set manageable goals every day. The latest research shows that the more control we have over our work, the less stressed we tend to be. Communicate effectively. Talk with your lead if you need any help with your workload or simply to check in on how you're doing that day. Try to be efficient with your time at work and set boundaries with yourself and your colleagues to prevent burnt out. It's okay to say no if you get asked to go in to cover a shift, or it's okay to say no if somebody asks you, to help them with the treatment that you really don't have time for. It's okay. Speaking of time, take time off. Do it. It's important to nourish your well-being. That way, when you do return to work, the hope is that you'll return ready and refreshed. So I talked about, the work part, but let's get into the life part. A couple tips for the life portion of this work-life balance is that you should find something that you love outside of work to engage in. If you have something that you're excited about doing after work, it'll make it easier to disconnect from work. You can plan ahead, but don't overcommit. Schedule time to hang out with your friends or family. Go visit that restaurant you've been wanting to try, or the brewery that opened up near you. Also, don't forget to unplug. Don't be afraid to unplug. Taking a break to unwind is critical to success, and it might, help you feel more organized and productive when you're at work. And lastly, practice mindfulness. As a lot of you have already mentioned, find a counselor or a therapist to help you identify, which changes will make the biggest impact and how to get started. Every practitioner is different, but ultimately the goal of a healthy work-life balance is to succeed at work and at the same time lead a fulfilling personal life. I do hope that what I've discussed will help, fellow practitioners recognize and acknowledge that work-life balance is important, especially so you don't reach the point of burnout. And also remember that a realistic work-life balance won't happen overnight, but it is possible to obtain when you take the proper steps. So thank you guys. Thanks for allowing me to speak on your podcast.
Thank you, Cynthia, for shining the light on work-life balance. And lastly, we have Bonnie. And Bonnie will be talking to us today about mindfulness and meditation.
Thank you, Chandra. Hello, everyone, and hello, listeners. Uh, I would like to talk about the mindfulness meditation and how it could help manage burnout, apart from all the great ideas that our panel member has introduced. RTs plays a vital role in healthcare. Mostly we work frontline, dealing with the patients directly. The demanding nature of our job uh, most of the time involves long hour, high pressure situations, and emotional patient interactions. So I think we are very vulnerable to burnout uh, compared to other professions. So I think mindfulness and medication can be helpful tool for both self-evaluation and improve patient care as well, because you cannot be administering albuterol while thinking about your ex-girlfriend, you know. So I think it's very important to be in the moment, taking care of your patient while it's necessary. And as Olga mentioned, that sometimes we're so caught up with the job that we don't realize how our work is changing our attitude towards everyone, unless someone tells you. So if before you go to that point, I think you should practice mindfulness and meditation. Take a break and just realize what are the progress or what are the things that you've been doing that could actually help you track your progress, track your day, and perhaps you could focus more on each thing at a time. And it's also scientific studies have shown that meditation could help reduce blood pressure, get a good night's sleep, and particularly we need a good night's sleep, because if you're not sleeping well, and next day you'll be like a zombie treating your patient. So I think it's very important to understand your the connection between your soul and your body, because if you don't understand how your body works and what your body needs, you're going to end up burnout anyway in any job. So I feel that meditation and mindfulness could be a helpful tool, apart from all the other ideas. And you can do it everywhere. You can practice mindfulness while working, eating, or even breathing. So I think it's a great idea to try this. It's for everyone, actually. Thank you.
Thank you, Bonnie, for the information on mindfulness and meditation. And that brings us to an end. And we hope that you enjoyed this episode of Breathing Easy. And a special thank you to you, our viewers, and to our speakers. Thank you all. See you guys next time.
Thank you.
Thank you. See you.